So imagine you're going for a leisurely walk one day, and suddenly you can't feel your feet. In fact, this condition progresses over several days to weeks, and next, you notice your feet and the legs are on fire. This gets so bad to the point you have to use a walker. And you see your doctor, and after his evaluation, he says you'll never walk normally again. This was a situation with a 76-year-old lady who is a cancer survivor with mild heart disease. She presented to our center, and I'll share with what we found and what we did next. So, tell us about the 76-year-old patient we encountered recently.
So she's a 12-year cancer survivor treated with surgery and chemotherapy, and also had mild heart disease. And she was doing pretty well after surgery until 1 year ago when she began to fall frequently and then became dependent on a walker. So she saw her primary care doctor, who told her she would never be able to walk normally again, and she came to us with a lot of fear of losing her independence and her joy of life.
So what was our assessment?
Most notably, she was very unsteady on her feet and dependent on the walker, and her feet were very cold on exam. I could barely feel her pulses or her circulation.
Wow, so this clearly points out a circulation problem, which apparently was the new problem that occurred a year ago. Now, my understanding from reviewing the chart, she did have some mild nerve damage from the chemotherapy, but she was doing well with that. However, this new onset circulation problem seems to be the biggest issue that she's dealing with now, which is very concerning to me because, this puts at risk for either amputation or becoming bedridden. And either of these conditions put her at a chance of dying, perhaps 15 to 40% chance of dying within a year of its occurrence. So we knew that we needed to work fast. So what did we do?
We prescribed her a nutrition plan consisting of food levels 0 to 4B for 1 month, and then after that, she did food levels 0 to 6 for 1 year.
Wow, so it's important to understand these food classification systems. Food level 0 to 4B is the cleansing phase of the nutrition plan. Food level 0 consists of raw plant foods that are liquefied. That means they're made into a cold-pressed juice or a smoothie. Food levels 1 through 3 are raw solid plant foods. Level 1 is low glycemic index. Level 3 is high glycemic index. This allows for the addition of added fiber, which helps feed the gut microbiome and also allows for increased protein and mineral absorption. Food level 4 consists of 4A, 4B, and 4C. 4A consists of high-fat foods such as seeds, some nuts, and also avocados. 4B allows for dehydrated foods. These are foods that are warmed at a very low temperature, maybe 130 degrees. This allows us to make breads and wraps, and this satisfies the palate and allows the individuals to tolerate the cleansing phase of the diet longer. 4C adds a little tiny bit of heat. Levels 5 and 6 add much more heat, to the point of boiling and steaming. We only use boiling and steaming. We rarely use heating except for maybe high temperatures up to 170 degrees. No grilling, no oils, no frying. This allows the food to be more natural in its state and healthier in terms of providing nutrition for the patient. It also allows the individual to sustain this plant diet for a prolonged period of time. So what else did we do?
So we started dry sauna therapy that uses an infrared light to open up the arteries and improve circulation. We also started beamer therapy, which is a painless electrical therapy that opens up the small blood vessels in the body. And we also stopped medications that lowered vitamins and other minerals that are important for nerve function and circulation.
So what was our outcome?
So the expandability of our arteries increased by almost 30%. The arteries became less stiff on Doppler ultrasound, and there was a 68% reduction in inflammation in the arteries. She was steady on her feet, and she didn't need her walker anymore, and she felt like she had gained her life back.
Wow. So there you have it. This lady with severe circulation problems, nerve problems, and with a relatively simple set of interventions, essentially returned circulation to her leg and life and hope to overall outcome and future. So I hope you learned a lot from that. If you have any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.